Welcome, everyone. Thank you to our queue, the folks that have been listening in here a few minutes before we officially got started. Welcome to everyone who is watching this online tonight and joining us. I would say probably one of my very best friends, my brother from a different mother. That's you. Eric Hartman is with us tonight. He's the director of advocacy for the Choroideremia Research Foundation. He and I got to be friends, 2008. Nope, 2006, I believe it
Six.
was
Yes.
2006 when we met for the first time. And we have traveled to many different places. Um, and we have a great, tremendous fun time together. So I'm so excited because as you know, a close friend, you preceded me as the president of the foundation. You were such a great resource and friend and encourager. Um, but I have seen you because we've attended so many of these meetings together, how valuable truly you are to the foundation, but your role is in rare disease. Um, and it's something that our friends here who were in the queue heard me say is when we've gone to the NIH, when we have been to different rare disease days, many
Hmm.
people know you. A lot of people, you are a recognizable face because you advocate for us. You ask knowledgeable questions, and it's just great. So sharing what you do. For the CRF in your role now, you've held many. So I guess as I looked at your notes before you started, but I really would love for you to share a little bit after you introduce yourself, share a
Yeah.
little bit about your history with the organization.
Sure. Well, thank you, Beth, very much for that very kind intro. And I will throw it right back at you that when Beth stood up in front of the FDA and for a public hearing on gene therapy, she spoke as a mother. And that was quite moving. And she got the whole crowd going. So here we go. I'm already choked up. This is crazy.
That's
All
good.
right. Anyway, I'm Eric Hartman. I am a 68, soon to be 69-year-old CHMer. I have advanced CHM. I have no vision in my left eye and just a very small bit of central vision, maybe 1 degree or less in my right eye. I've been with the foundation since it started. I was elected to be the first at-large member at our in-person meeting in 2000 and have been with the foundation on the board of directors, then served as president and then executive director. And now I work as the director of advocacy. And I've been doing that for probably 6 or 7 years, maybe actually, I think it's getting close to 9 if I'm thinking back. But my history with the foundation is long, but the thing about it is I started just like each and every one of you. I was a patient and I just wanted to know more about the disease. Having grown up in the 60s with no internet, I didn't meet anybody with my eye disease until I was 40. So, with the dawning of the internet, that has given us all the tools to become better advocates. I have had the real honor of being able to represent the foundation. All of you, thanks, all of you that are joining us now or joining us on video, especially thanks to those of you that have already made donations or held fundraisers for us, because your money is the money that funds our efforts to move us closer to treatment and cures and support of our global CHM family. I've had the real honor of actually traveling and speaking on behalf of the CRF in 11 different countries across Scandinavia, Europe, and even into South America. So it's been a very interesting journey to see us as a global organization. And because we are such a global organization, and have been heralded as now the gold standard. I'm so lucky to have so many people. I'm just following in the line of so many people that have put in their time and effort as volunteers to the organization and to our staff Kathy, and all of our board of directors that support our work. Um, I, our organization became one of the first single rare eye disease foundations to be admitted to Retina International, which was a global representative on behalf of all of the retinal diseases. And prior to us joining, they were all national retina groups representing each country. But because of our global impact for our patients and the research that we fund, we have been able to become a full member there. And I've had the good luck to be able to travel and speak on our behalf in Iceland and at the most recent Retina International meeting in Dublin. I
Mm.
spoke on a panel there, but we'll get back to a little more Retina International. But everybody should, if you're in the United States and you may be familiar with the FFB, they will be having a joint conference with Retina International. And that'll be next year. And it'll be the first time Retina International in a long time has actually held their World Congress. And it'll be in Texas, I believe, as I
Oh,
recall. Beth, how am I doing
you're
following up?
good. Um, I think let's start off with this. I bet we all have kind of different interpretations or ideas of what is advocacy. What does that mean, and why is it important for our organization?
So advocacy it can be very, very personal. You as a patient are your own advocate.
Mhm.
You are in control of going to the doctor, of asking questions of the doctor, of being able to inform yourself as a patient. Advocacy for the CRF falls in a number of different areas. We want to be able to educate our members. First, we wanted to find our members,
Mhm.
but we also need to look at a much bigger picture. Um, when we all started this, we just wanted a cure. And I had no idea the alphabet soup that I was going to be stepping into as we moved further and further along through research. But one of the things that I and our board members realized is we didn't want to reinvent the wheel. There are lots of other successful nonprofits out there. And in order for us to learn from them and they now from us, it was to become very, very active in the global advocacy and rare disease patient advocacy groups. Because advocacy, by its very nature, we are looking to educate our patients. We're also looking to educate regulators. We're looking to educate pharma about us and
Mhm.
researchers.
Mhm.
We are looking for collaborations. We are trying to leverage our funds into being able to bring in a collaboration from different directions. We look to leverage our funds by listening to new research or new things that other organizations are doing. And if there's something that that helps us push us towards our mission of finding a treatment and cure in support of our patient population, then we want to be able to do that. We want to be able to leverage those funds, make us as strategic an investment as we can to then move forward. And
Mhm.
that's how we as an organization, through our advocacy, have found so many of our researchers. One of our great volunteers and a great patient advocate was Randy Wheelock, and I went to many meetings with him. And it was through our lobbying of certain researchers that we were able to talk them into taking on CHM. And they're some of the global leaders that you know now.
Yeah, no kidding. Yeah. Cheers for Randy for sure.
Yeah.
How does now, as you were talking about the advocacy, how does that adjust or change with rare advocacy, like the challenges that we have? with
Well,
that?
that's part of the problem of rare is there are so few of us.
Hmm.
And part of the challenge as a rare patient community is most pharma don't want to invest in us. So long before there was ever a CRF, there were rare disease patients in the early 80s that worked really, really hard. And in January 4th, I think, of 1983, the Orphan Drug Act was signed in. And what that did was that gave incentives to pharma to invest in rare disease research because they could get either a tax credit or extended copyright or patent rights for some of their other drugs if they worked on a rare disease. So that was a huge incentive, and that helped bring forth a number of efforts along the way. And those are the types of things that we need to do and continue to do as an organization. It's really really important that we work with other groups in order to support that effort.
Hmm. You know, one thing I'll remember you saying, or that we attended some of these together, and I was struck by how many rare and ultra rare diseases there actually are. Um, Especially when we went to Rare Disease Day at the NIH.
Yeah,
What a experience that has been over the few times that I have accompanied you to that. But share a little bit with our audience too about, if you remember, I hope you do, a couple of the people that after you did an address or you were asking a question to the presenters, um, people started approaching you from other rare disease organizations saying, how did your foundation do this? Share a little
right.
bit about that.
Yeah, there's been numerous occasions where we, having learned from other organizations, we've taken the initiative to do things like create our own biobank. Choroideremia, as we know, has been a real challenge to come up with an animal model, and it's still challenging, but we're still working at it. But in the meantime, it turned out they started using things called induced pluripotent stem cells, which are stem cells that are taken from our bodies. And we're not talking embryonic. They literally took a skin sample of my arm and isolated the stem cells from that and induced them into becoming pluripotent. And I'm one of the early CHM cellular models where I'm in I'm in a couple of the biobanks where they have our RPE cells and photoreceptors there and our fibroblasts, and those can be very very helpful. There's quite a number of times where we have argued about having rights for our patient's natural history. And we've stood up at a number of these FDA hearings to talk about how important it is. And through our work, through the National Organization of Rare Diseases, they are rare disorders, I should say. They had formed a group or a collaboration with the FDA under an organization called the Critical Path Institute, and this is where the acronyms come in. There's the RDCA DAP, which stands for the Rare Disease Cures Accelerator Data Analytics Platform. But what it was, it's funded by the FDA. It's run through the national or through NORD in collaboration with them. But it has become a a great place where we can put our natural history data in and keep it safe. It's depersonalized natural history. When we get this data in, it doesn't identify who the person is, who the patient is, but just their profile, so that we are able to hopefully over time. And Beth, you sat in with me at the NIH's the NCATS, which is the National Center for the Advancing of Translational Sciences. NCATS is building computer models based on natural history. And that may be another road, and we still don't know yet, where we might be able to build a control model, which is necessary for trials. If we could find natural history markers, biomarkers there, that may, in the years to come, be vital in being able to get a gene therapy or other types of therapies approved as a control.
You know, you've listed, I'm reading, the notes that you shared with me, and you have the rare patient advocacy organizations listed out here. I'm not sure if you want to go over all of them, but are there a few key ones that you want
Sure.
to share with the group that are the most important
Well,
to
there's NORD, the National Organization of Rare Disorders,
Mhm.
and I'll talk a little bit at the end about that, about some of the educational possibilities. That's one of the biggest and strongest natural or rare disease groups, along with Global Genes, which
Mhm.
merged with Rare X, and we are in a rare vision consortium for that. And as we were getting closer to having a potential approval with the Biogen, one of the things we all needed to understand is you need to go through the approval process. And part of that is being able to show what the cost is for having CHM. So there, we worked with an ultra rare organization, or a an organization for ultra rare diseases, of which we're actually considered ultra rare, and the Haystack Project.
Mhm.
And we were able to get a patient oriented valuation that would have been used if we had gotten the approval or gone before the FDA. That was going to be one of the valuations to show what it meant to have the social costs of having CHM. It can become a bit complicated, but these are the things you learn over time as an advocate. And then, of course, there's the European groups, and one of the neatest ones, and some of you may have seen my posting about it, is the ERNI, which is the European Resource Network. And they just produced, excuse me, a really wonderful 3-minute video explaining to people the socially proper way to offer assistance to someone who's visually impaired in a public place, instead of coming up and grabbing their cane or whatever. They just, it was well done. It was designed by professionals, and all that is through the collaboration of global patient advocates that was created.
You know, one thing that is at staff meeting, folks, when we get to on our weekly staff meetings, Eric will share um, where you've been, the amount of travel, how little sleep, waiting in airports. It's astounding, the sacrifices you personally make for the organization. However, all that to say, talk a little bit about when you went to the Capitol, going back and forth, back and forth. Share, Eric's been to the Capitol representing us more than several occasions.
Yeah, there's the one of the rare disease groups besides NORD and the others is also the RDLA, the Rare Disease Legislative Advocacy, and that's part of the Every Life Foundation.
Yeah.
And what they work on are lobbying Congress to be able to get certain measures passed that are important to rare disease groups. And in our case, in many cases, we're adding our voice for other rare diseases because they were there for us early on with the Orphan Disease Act, which has proven that was crucial for us when we had our first trial. But things like newborn screening and you go there for training, and it's a full day of training, and then everybody is divided amongst their states of residency, and then they set up appointments, a full day of appointments on Capitol Hill, where you're going to all the different office buildings for the House of Representatives and the senators. And then it culminates the next day with the rare disease congressional caucus meeting, which is a pretty extraordinary thing to attend. It's in one of the big meeting rooms there for Congress. And generally, you will meet some pretty important members of Congress that have made commitments to help advance rare disease advocacy and the things that we need to advance our trials.
You know, Lisa, I'm asked a question and it's exactly the next area you want to touch on, but she said, what progress or milestones have been most meaningful in recent years?
Well,
And
in recent years for us
Mhm.
as a foundation, it was through our continued advocacy. We kept trying to get our natural history data for the 160 patients that were part of the natural history study in the Nightstar Biogen trial. And that data could be very, very helpful in the future in trying to understand CHM. But it was sitting in silos at the various centers of excellence, as they call them, where the trials were held, whether it was in Europe or in the United States. And then it was ultimately all that data was sitting with Biogen. And we kept asking, and nothing seemed to come of it. But after 2 years of going, or 3 years of NORD talking about the RDCA DAP, and me actually sitting at luncheons, because that's one of the neat things about NORD is they bring in the federal regulators and the shakers and movers, and you can choose a table to sit at if you get to it quick enough. And I sat in a room with the people with the Rare Disease Cures Accelerator program, and they're on 2 years ago. There's a rare disorder called Friedreich's ataxia that actually used their natural history data in the RDCA DAP to create a model that were able to show to the regulators that the current drug that they were trying to get through did in fact work, and it became the control from which all of that worked. And I was astounded by that. And then it turned out, because the small pharmaceutical that was running that trial had just sold out to Biogen, and as as they were announcing each person's name around the table, introducing themselves, they said Biogen, and my head went up. And the head of RDCA DAP said, "I thought you'd notice that, Eric." And we were able to suddenly start leaning on them, and we're able to get, because Biogen now saw the value of this, they were able to begin working with us to get that data out. So that was huge. Also, I will say, with all the things that are going on with the downsizing of Congress of federal agencies and budget cuts and all that has been going on. In 2014, there was a large move, a proposal that was going to consolidate all of the, I think the National Institutes of Health, I think had, correct me if I'm wrong, is it 21 and they wanted to reduce it to 12? And one of the things they wanted to do was consolidate the National Eye Institute, the NEI, into a neurological and
Mhm.
brain
Mhm.
institute. And many of us felt like we were going to get lost, that lobbying that we have been doing for eye research could have that revenue diverted elsewhere. So there was a huge effort in this last year, and I signed on behalf of the CRF on a number of letters explicitly telling us why we shouldn't do it. And in fact, as it turned out, I was getting on a flight here in New Orleans and happened to see one of our US senators, and he was going around shaking hands. And I talked to him and thanked him for his help with other rare diseases and told him just how horribly opposed I was to the idea of the consolidation of the NEI. And I just checked, and that proposal is now dead because of the or the patient groups, along with the big professional groups like the AAO and ARVO, which is the big eye research areas. So those are two of the big pluses, and we were part of helping fight for that. So that I took as a really big plus for us.
Now you have listed down in your notes at least a dozen memberships that we belong to, organizations that are important to us.
Yeah,
Uh, you've touched on a lot of them already. Are there any other ones, medical professional organizations,
yeah,
or other ones that you would like to share with the group?
yeah. There's one, the ISCADR, the International Society of Genetic Eye Disorders and Retinoblastoma. That is a gathering of the true genetic eye research people. And I was able to attend my first ISCADR conference because I was already in Europe. I had gone to visit a friend in Denmark just at the end of COVID. And I found out that ISCADR was going to be in Switzerland, and the foundation was able to see their way to cover my travel to there. And that gave me huge inroads with some of those doctors, from which I then, from that particular meeting, I was later invited to be a presenter at ISCADR as they were bringing more and more the patient um, point of view into their own meetings. And I was a presenter in Sao Paulo, Brazil, which then gave me the ability to stay for another week and speak to the national uh, ophthalmology organization for all of Brazil, to speak on behalf of the CHM community. And then I was able to also then move and pivot to speak to basically the Retina Association of Brazil, and they have brought in a lot of CHM patients, or were going to, until they found out that they were going to do it on Zoom. Because for those of us that don't have a lot of geography, Brazil's about as big as the United States, so their populace was scattered. But I was able to have some really great conversations with CHMers there.
That's amazing. It's awesome.
And then also in there, wrapped in that, is also our work week, because we're always looking for our patients. And one of the things we realized is we need to get to, we worked with AA which is the American Academy of Optometry, and Corey and Jason have been advocating really hard with that group. And I've attended one here in New Orleans. And through that organization, people that weren't going to see retina doctors were just going to optometrists. And now CHM is on their certification education exams to be certified in optometry. They need to know about CHM because we had webinars there. We've done the same at ARVO, that's helped spread it. But beyond that, we've also done a lot of work. I belong to the United Kingdom's ophthalmology genetic group, along with the American or the North American group of genetic counselors, because in speaking to them, letting them know that we are there, they're the genetic counselors that when someone does get a confirmation of CHM, they're able to offer them a route of support and a way of being able to learn to begin to deal with their diagnosis. And in fact, after that webinar that I did with them as a presenter, one of the counselors called me within 2 hours and said, "My next patient was someone diagnosed with choroideremia," and I was able to tell them about you guys. So those are neat moments.
We had some nice comments in the chat, Eric, and Lisa said she's never heard so many acronyms in one webinar. And I too, like Lisa, are very impressed by how effortlessly they just roll off your tongue and how you can keep them all straight.
It's a little crazy. I was going a little cray cray early on, but after a while, you know, 20 years of hearing it, you begin to understand it, you know. But it's not as hard as you think. I mean, there are so many acronyms in our own lives, but I've enjoyed it, and there are ways that um, you, as patients, can learn to be your own advocates. In fact, our membership with Nord allows you as patients to sign into their patient portal. And I sent Beth a link in that listing there, and we'll be able to put something else together, probably in a newsletter article, where there's a whole education portal where you, as a patient, can go in and learn about your rights to your own patient data, to learn about what a gene therapy is, or to learn how to be your own best advocate, how to become a patient advocate. And that can be really helpful. And if you decide you want to get involved with with our foundation, and we do want people to get involved, it's good to understand what it means to end up joining the board of directors. And they've even got a 90-second course that you can take to gain a better understanding of what it means to be on a board of directors of a nonprofit.
There's a couple things I was writing down. I wanted to just touch on. You've been with the organization since it started. Oster, Corey, a handful of others
Yeah.
that are here with us and some that have passed on. And you've held many different positions. Why do you think, two-part, why do you think advocacy is important for our foundation now in this 2026 is going to be? And why is it important and what do you like best about it?
Advocacy is important because we are teaching people, but we as a foundation are learning. There are always trends in nonprofits and in research. And if we can find ways of advancing uh, our own cause through understanding what other people are doing, it becomes incredibly important. All of us know, and rightly so, are disappointed that we didn't meet the endpoints of the biogen gene therapy trial. And we all know we need more endpoints. But I want everybody to know that you're not alone in that feeling. We, as the CRF, are not alone, that there are numerous organizations that are out there working to find better objective measurements, because for the real challenge for choroideremia is also its blessing. It's a blessing in that it progresses slowly, but it really confounds trying to find a good biomarker in a reasonable amount of time to show that a trial is effective. If it's moving really, really slow, a lot of pharma people don't want to wait 10 years to see if their drug works. So there's a lot of work that needs to go into it, and it's through our organizations. I was a panelist at a convening of 45 uh, leaders in eye research. It was the Research to Prevent Blindness Foundation. And in that particular meeting, one of the things Corey and Jason had found was an objective field measure. Many of us have taken our field test where you're clicking when you see the light come in from the side, clicking, and it becomes even harder for those of us with advanced things. And there was a machine all of us have gotten tested on that you don't need to click a thing; it does it independently. And I brought that up at that meeting, and it turned out that one of a different disease, it was diabetic retinopathy, that the Mary Tyler Moore Vision Initiative is already studying that machine. And there may still be a way that we might be able to get some CHMers to be tested within what they're doing, because they're testing that machine versus the old or the traditional measurement to see if they are both following the same line. And if they are, why wouldn't you want one that's more objective as opposed to relying on someone clicking with their finger or
Tired
struggling?
eyes.
Yeah. So,
Um, so all of this to say, we have a question that I want to ask you from
sure.
Stefan. But when you do advocacy, it also empowers the patient,
Yes.
right? Tremendously when you feel like you can have an active role in this. So that's the question that Stefan is asking. How can we personally help advocate with regulators, Congress, pharma, et cetera?
There are a number of ways of doing it. You can become a volunteer. There are organizations we can work it out through me, but there's the Every Life Foundation, which sends out a daily um, response of what's going on legislatively, and the legislation. Congress isn't even meeting, so that becomes problematic right now. But beyond that, you can begin to see what's going on. You as a patient can be your own advocate with your doctor. Many of us will go into the doctor, and one of the quickest patient advocate things you could do is they come in and they want to put that bright light in your eye. And if I know I'm probably going to need a new prescription, I said, before you do that exam, I want my visual acuity measured. And I also want you to reduce the intensity of that light because it's painful.
Mhm.
And you can change the way just even your own exams are made, and it can help you.
Mhm.
But many of these doctors don't realize it, or they're just going on. They've always got the thing on the brightest setting, and it can be very difficult. And if they shine that in your eye, then they want you to try and read, and it's going to take me 15 minutes for my eyes to adjust to to a clarity for me to be able to do visual acuity. But if you want to get involved, as I said, we will have a link that will be posted with this video, and we can send up follow-up emails that will have the portal for NORD, the National Organization of Rare Diseases Learning Center. And there are these are only 90-minute courses. They're videos. I also, as a patient, I'm always looking, searching on YouTube, because there's lots of really good presentations. I actually also joined. I somehow talked my way into being in a weekly symposium run by the University of California, Irvine's Center for Translational Ophthalmology. And I sit there with doctors as they do their presentations on a doctor's level. But over time, some of that begins to
Stick.
sink in. And now I know that, the the signal of the eye goes up to the bipolar cell and through the horizontal cell and another cell before it goes to the nerve ganglia and to the eye, or it might circle 3 times. I mean, you begin to learn the complexity of the eye and of vision, and that can make I think for you as a patient, the more informed you are, the more you too can look and say, "Hey, wait, what about that type of therapy?" Because there could be other therapies. We are always looking. Kathy is always talking with the pharmaceutical companies, and whether it's drugs or other cellular therapies. The cellular therapies go through the Center for Biologic Evaluation and Review at the FDA, and CEDAR, which is the Center for Drug Evaluation and Review, handles all the chemicals, the pharma end of it. And those are the people that are going to be doing the review. But we as a foundation need to make sure they understand what our vision is. And Beth has been part of it. When they have had public hearings, we as patients, if we can get there, will participate. There are also webinars that are on many times during the year. If you want to learn more about advocacy, learn about the legislative end, um, I can hook you up with where you can sign up for those webinars. It's many times it's over your head, or if you can't make it, you can't make it, but it's always an opportunity to educate yourself and to help us in our advancement for a therapy and research. It also makes it a lot easier to explain your eye disease or the condition of your loved ones to friends and family, because the more you know, the more you can explain the complexity and the need for the research, which costs money.
And you touched a lot on the advocacy piece in terms of the science components, but if you want to get more, those that are here with us today and will be watching, um, just getting involved with the foundation, the Choroideremia Research Foundation. I think to any extent where your gifts and talents are, you can reach out to Kathy, you can reach out
Sure.
to me or Eric or certainly Corey, and we'll be able to link you in. And then you learn with time. And again, it builds up your tenacity and your perseverance and your
Yeah.
courage. There were a couple more things, Eric, I wanted to just ask you about because you do on social media quite a bit. Traveling.
Yes.
Um, if you would just spend a few minutes, and I wanted you to tell the group about your great lights, about Alexa. Those are the two things. And we have about like 10 minutes left.
Oh, okay. Yeah. Yeah. No, I do a
Take
lot of
any more
traveling on.
questions. Want to make sure that if
Yeah.
anybody has any questions,
Yeah. If anybody has any more
use the
questions,
chat feature or the Q&A.
please do that. I will say one of the ways you can educate yourself or just kind of keep up with things, there's a unique feature in Google and it's called Google Alerts. And you can go into Google Alerts and type in keywords like choroideremia or site replacement therapy, and you'll get alerts of the newest um, postings of research that's going on. Again, you may not always understand all of it, but it will certainly get you to begin to advance your own personal knowledge. And it keeps you more abreast of just what's going on. Because I have to say, when we started this foundation, we couldn't find anybody that knew what choroideremia is. Now we're at the point we get more research requests than we have money for. It's extraordinary.
Mhm.
Oh,
Yeah.
but then again about flying. So for me, I do a lot of traveling on my own. I if anybody wants, maybe I'll do another thing on just how I travel, because I do travel alone. I always travel with at least two canes, sometimes three, depending on where you're going. If I have to go to Europe, I always go with three canes. I have an all-terrain cane and I have two urban canes. I know when I travel through Europe that there are services on with the train service that you have to be organized and get your tickets ahead of time, and then you can set up itineraries where when I land in Charles de Gaulle to go to the CHM symposium in the south of France, I take the train, but I get escorted through the airport. I get to the train station. They know that I'm coming, and they will walk me to the platform to where my train car is going to stop, put me on into my seat. And if I have to have a connection at another train station, I get off and there's another guy in a little red vest or woman who
Mhm.
then leads me to a waiting area or to the connecting train if it's close. So those are really great. And in Europe, many of the major airports actually have a waiting area for those with travel disabilities or the elderly. But it's a nice meeting. It's a nice area. The bathroom is right there, so you don't need to go try and traipse down the concourse. And they have free coffee, so it's all good. And then they lead you out to your plane 20 minutes before the flight boards. So, but I
Anything?
find being organized is a huge, huge thing, and having a lot of patience. I've always got at least two audiobooks that I can get to, because inevitably there are going to be changes, but you also need to be your own best advocate.
Um, I think that answered his question. And any other, we're going to take just another minute if anybody would like to answer or ask Eric
Now,
any questions. Uh,
so
oh,
my
here's one. Can I
okay,
ask this one? Um, when going to get your prescription updated, why test acuity first and then do the light test? Good question.
Why visual acuity first? Because your eye is going to be shocked by the bright light. So wouldn't you want your eye to be less stressed before they do any dilation? You want to get your visual acuity done first. And if you don't get it done first, many times and it happens to me at LSU med school at their ophthalmology clinic, they'll tell me to come back. And I said, I'm not making 2 trips. Let's do the visual acuity. It's not going to take long because I don't have that much vision. But, let's get that done first. And then you can start putting drops in my eyes.
Got it. That makes sense. Thank you. It does make sense. So show everybody your cool lights.
Oh,
Or
well,
just maybe, hey, I interrupt
yeah.
myself. Um,
Alexa.
about your technology, because you probably are probably the best in the organization that I know of that has, so you've taken time and learned. It's taken a lot, but
Yeah.
your house is set, your
Yeah. My
devices.
house
Yeah.
is fully integrated. I take advantage of, and y'all may want to think about that with Black Friday coming up. It's soon. You can get the Alexa speakers, and they need to be close enough. You also have to have a good Wi-Fi. But I can say, Alexa, turn off house. Alexa, turn off house.
Okay.
Off goes the house. Alexa, turn on ceiling of office.
Okay.
And I can control all the lights individually, and it makes life a lot easier for me. And then I will say that, and I know Kathy's going to say, and we're going to be doing a video on that. This is one of the coolest things ever. This is called a Stella desk lamp. It sits on a pad that has a battery, a rechargeable battery. It can go up to 10 hours, and I can take this with me into the kitchen. I live alone, and I can put this on the table and put it over the stuff that I'm chopping, and I always have really good light. I move this into my bedroom when I'm folding clothes to make sure I'm matching up the socks correctly or whatever. It's just one of those little practical tools,
Bella.
you know.
I've heard of different guys, and we were over at Oster's house, and he had the lights on the bottom
Yeah,
of the stairs.
yeah,
And I've heard other people say that they put the cording light around the
yeah.
baseboard on the stairs. How have you used it in your home?
I've used the rope lights across my whole house along the crown molding because if you put stuff down on the ground, and my apartment's small, I want the dimensions of the room. So I will, uh, let's see, I think I can turn this a little more that way. You'll see darkness over there.
Mhm.
Alexa, turn on living room.
Okay.
And you may be able to see that the lights in that room have gone on.
Yeah.
And then I can turn on the lights in the kitchen as I'm walking to the kitchen. And that gives me the visual, a bright light to walk straight to throughout my whole house.
Hey, turn
So
your camera a little bit more to the left, although the artwork is really nice.
thank you.
Nope, other way.
Otherwise, too much.
Uh, there we go. There we go. Yep.
Okay. So
Any other tricks of the trade that you want to share with
no,
everybody? We're
I will
good.
say this: the artwork behind me is artwork that I've just started doing because my color perception's gone. And any of the paintings that you may have seen, the artwork is stuff that I used to paint as an impressionist painter. But I've just gotten into actually doing sculpture, and these are clay sculptures that I'm doing completely by touch that are 14 by 14. And then a friend of mine is doing rubber molds of them. And then I do plaster castings of that and then paint them
You always
with
have
metal.
something going. Always have something going.
You
And
know?
talk a little bit just for another, we experienced your flying thing in the air, your drone.
Yeah. Well, I travel a lot by myself, and there's lots of times that I really wish I could have better pictures because I'm alone. And the idea, I now have what's called the Hover Air Pro Max, and it's an autonomous drone, and it can launch from my hand in a flight pattern that I choose, say orbit, and it'll go around me, and you can tell it to go high, low, or
Mhm.
how far out. And what it does is it means I can be in a position where I could launch this thing and show this amazing panorama of where I'm going to be, and share that with people, because I want people to know that you can get out there and hike and walk. I'm in fact going to be going out to Sonoma and Napa for Thanksgiving week, and I'm going to do probably a couple videos of me walking in the vineyards, and the drone will be following me, or staying in front of me as I walk along these trails, so people can be able to see what's out there, because you don't need to sit at home.
Preach.
Yes.
You are very encouraging, my friend. Very astounding.
Well, I don't know about that. My mantra when I travel is pay attention or die. So, there is that.
There is that. Oh man. Well, it's been a pleasure talking with you. And I know that you're always open if folks want to give you a call
Yes.
individually or reach out. You want to give them your email address?
Yes. My email address is Eric, ERIC, Hartman, HARTMAN, all one long word, at curechm.org.
Mhm.
And there are videos of some of my interviews that I've done on the Choroideremia YouTube page. There's a lot of really good information. If you're new to this group and you want to find out more about the research, you can go to our YouTube channel and just scroll down. You can look at the individual channels, because I think Kathy set up a couple different playlists or whatever, where you can go to certain research or to the conference, and that it allows you to go in and educate yourself, because there's really cool stuff in there. If you hear the term retinal mitochondria and you're like, what is that? I always just go into YouTube and do a search and then click on video, because otherwise you get all those crazy little short videos. But if you click on videos, then you'll be able to see a lot of really good presentations by doctors like David Gam or Dr. Sang, many of our researchers. Those are really, really good. And if you want to see any of my crazy travel exploits, just look
Mhm.
up Eric Hartman in YouTube. I'm also known as the BLT, the Blind Low Vision Traveler. And you can see me walk across a suspension bridge from one Swiss Alp peak to another.
You have had your experiences, and this has been wonderful. It's just
Well,
been
thank you
great.
guys. Again, if anybody wants to get in touch with me, I am also always available by phone. Just email me and I'll set up a way. I'll send you an email back, and that'll have my cell phone number on it, and we can talk.
Thank you for your time. Everybody, thanks for joining us. I think this had multiple effects to learn about your role, certainly about an advocate, that we all can be our own advocates. And just because we have a low vision does not mean that our lives have to be anything
It's
less.
not a disability, it's a different ability. And you can certainly get out there and get things done. I know amazing, fully blind people that have just gone up Kilimanjaro. I mean, just crazy things. And they get out there and they do it. At our conference, they had the blind sailing. Look around for the resources that are out there locally for you. And if not, talk to us and we may be able to hook you up.
Right. All right.
Well, thank
Thanks
you
so
guys. And
much.
don't forget, make a donation to curechm.org, because we can't do it without your assistance, and your help is incredibly important. You are making a difference just by being on this call or by clicking on this video, and you can make it even stronger by helping us in our fight. So thank you.
Perfect way to end it. There we go. All right. Good night, everybody. Thanks for joining us. Thanks, Eric.
Thank you.
Bye.